The word epidemic gets used a lot these days, but it may be the case that that word is not strong enough to describe this country's recent surge in opioid addiction.
America is in the midst of an opioid drug epidemic.
The opioid crisis is an emergency.
Opioid addiction is reaching epidemic levels.
Drug overdoses now kill more people than guns or car accidents.
The opioid crisis has become more and more relevant over the last few decades, but opioids are nothing new to the United States. But before we get into that, what exactly is the opioid crisis? The opioid crisis refers to the misuse of and addiction to opioids, including prescription pain relievers, heroin, and synthetic opioids such as fentanyl. It has become a more serious national crisis that affects public health as well as social and economic welfare. Opioids are a specific class of drugs. To be exact, they are a compound resembling opium in addictive properties or psychological effects. To keep it short, opioids are extremely addictive drugs that are most commonly prescribed to relieve pain, but have now led to a surge of drug-related deaths and addiction in the United States.
Opioids gained relevance in the United States following the Civil War, as drugs such as morphine were issued to wounded soldiers to relieve pain. As a result, many soldiers developed a dependency on the drugs. In 1898, heroin was invented and was marketed as less addictive than morphine, when it wasn't. To this day, heroin accounts for a vast amount of drug-related deaths in the United States.
Throughout the 1900s, the United States made a variety of legislative efforts and various laws to limit the sale and abuse of opioids, starting with the Harrison Narcotics Act in 1914, which requires a written prescription for any narcotic. In 1924, the United States banned the production and sale of heroin.
The opioid crisis is broken up into three waves. In the 1990s, OxyContin was produced for the first time by Purdue Pharma, which is owned and run by the Sackler family, who are largely responsible for the opioid crisis due to their deceptive marketing practices. During these years, there was a sharp increase in the prescription of opioids and people combining opioids with other medications. Pharmaceutical companies also began to promote the use of opioids in patients with non-cancer related pain, even though there was a lack of data regarding the risks and benefits in these patients. By 1999, 86% of patients using opioids were using them for non-cancer pain. The second wave of opioids started in 2010, following a sharp increase in deaths from heroin abuse. This spurred an effort to make heroin more difficult to obtain. However, death rates continued to skyrocket. The third wave began in 2013, as an increase in deaths related to synthetic opioids such as fentanyl. Now it is the responsibility of the government to fix the crisis that is devastating our country. However, the opioid crisis doesn't always get the attention necessary to make change. Our essential question is, examine the successes and failures of the government surrounding the opioid crisis and determine what the government should do in the future.
To answer this question, we need to look back at statistics to determine the severity of the crisis. Opioid-related deaths are much more common than most people think. Over 130 people die each day from opioid-related deaths, and nearly 50,000 opioid-related deaths each year. Last year alone, over 12.5 million Americans reported to misusing prescribed pain relievers. According to the National Institute on Drug Abuse, there is a growing presence of opioids among youth as well. These statistics indicate that the opioid crisis is a huge issue. Death rates continue to rise, but no major change has been made, so it is time to cut down.
Although the government has taken action in the past to improve the opioid crisis, none of the legislation and government action has been that effective. In 1971, President Richard Nixon declared a war on drugs.
I began the meeting by making this statement, which I think needs to be made to the nation. America's public enemy number one in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive. I have asked the Congress to provide the legislative authority and the funds to fuel this kind of an offensive.
The war on drugs made no productive progress. Rather, it was racially driven as an attempt to incarcerate African Americans and others of racial minorities and associate them with illegal drugs. Shortly after Nixon's declaration, Congress passed the Drug Abuse Office and Treatment Act of 1972. The government addressed the problem of drug addiction, and it was one of the first major legislative efforts to cut down on the United States drug problem. In the act, the government acknowledges the correlation between heroin and crime and the lack of knowledge regarding drug abuse. The act states, "The Congress declares that it is the policy of the United States and the purpose of this act to focus the comprehensive resources of the federal government and bring them to bear on drug abuse with the immediate objective of significantly reducing the incidence of drug abuse in the United States within the shortest possible period of time and to develop a comprehensive, coordinated, long-term federal strategy to combat drug abuse." Clearly, the government wasn't very successful with this, as drug abuse was not reduced and no progress was made within the shortest possible period of time. The government under Nixon and the following 20th century presidents was very ineffective in making any progress to combat the opioid crisis.
President Trump declared the opioid crisis a national emergency in 2017.
Effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law, and why I am directing all executive agencies to use every appropriate emergency authority to fight the opioid crisis. We're working with doctors and medical professionals to implement best practices for safe opioid prescribing. The U.S. Postal Service and the Department of Homeland Security are strengthening the inspection of packages coming into our country to hold back the flood of cheap and deadly fentanyl, a synthetic opioid manufactured in China and 50 times stronger than heroin. I will be pushing the concept of non-addictive painkillers very, very hard. We have to come up with that solution, where we will be building a wall which will greatly help in this problem. Every person who buys illicit drugs here in America should know that they are risking their futures, their families, and even their lives. There is nothing desirable about drugs.
And since his inauguration, the government has made some decent progress. As you can see in this graph, there has been a slight reduction in deaths since Trump's inauguration. Here we can see an address of the House from John Katko. He reveals that the amount of fentanyl seized by the ICE last year was enough to kill every American twice. He uses this statement to promote his bill in Congress, which would limit the trafficking of opioids. This displays the idea that people are recognizing the seriousness of the opioid crisis and are enacting legislation to change. In 2018, Congress passed the Opioid Crisis Response Act of 2018. This act puts more restrictions on prescribing opioids in order to control the amount of opioids being prescribed. Additionally, they are putting restrictions on the supply of prescriptions. This act also tries to implement a safer disposal of drugs. This legislation is a decent start to stopping the opioid crisis. However, it isn't enough. President Trump has yet to decriminalize drug addiction, which is the first major step to solving the crisis.
We must decriminalize drug addiction in the United States in order to make progress. Why do we support decriminalization? Ending criminal penalties for drug possession, often referred to as decriminalization, means nobody gets arrested, goes to jail or prison, or faces criminal punishment for possessing a small amount of a drug for personal use. According to the United States Human Health and Services, roughly 50% of adults in the United States have done an illegal drug at some point in their life. Putting half of the American adult population in jail would be a waste of tax dollars and resources. Often, those incarcerated on drug charges are of minorities, which dates back to the institutionalized racism from Nixon's war on drugs. Discriminatory enforcement of drug possession laws has produced profound racial and ethnic disparities at all levels of the criminal justice system. Black people comprise just 13% of the United States population and use drugs at similar rates as other groups, but they comprise 29% of those arrested for drug law violations and 35% of those incarcerated in state prison for drug possession.
2020 presidential candidate Elizabeth Warren has said, "The opioid and addiction crisis is a national emergency that touches all communities regardless of location, average income, or racial makeup. It's long past time to enact comprehensive legislation. The crisis has also severely impacted communities of color, exacerbated by existing health disparities. For example, in 2017, the number of opioid-related deaths was 692 in Baltimore, almost as high as West Virginia 833, the state with the highest death rate in the country, with most deaths occurring in the Black community. That was from Elizabeth Warren.
Those who are addicted to drugs, specifically opioids, need help from rehab centers, not prison. Decades of empirical evidence from around the world shows that reducing and eliminating criminal penalties for drug possession does not increase rates of drug use or crime, while drastically reducing addiction, overdose, and HIV and AIDS. Today, as overdose deaths continue to skyrocket all over the United States, people who need drug treatment or medical assistance may avoid it in order to hide their drug use as they fear criminal charges. If we decriminalize drugs, people can come out of the shadows and get help. Portugal is an example of a country who has decriminalized drug addiction, and as a result, they have seen lots of positive changes and rarely have drug-related deaths relative to other countries.
Another aspect of the opioid crisis that requires change is the corruption in pharmaceutical prescriptions. Throughout the last few decades, families like the Sacklers who run Purdue Pharma offer bribes to doctors to prescribe addictive drugs. The Sacklers are profiting off an epidemic that is killing millions, and this must stop. The government must cut down on large pharmaceutical corporations looking to profit off the opioid addiction.
Luckily, new faces who prioritize the opioid crisis are entering the American political atmosphere. Politicians like Andrew Yang and Elizabeth Warren, who are running in the 2020 presidential election, agree with our stance that it is time to prioritize and end the crisis. Andrew Yang has said, quote, "I will declare a state of emergency and commit billions of dollars to the fight, much of it from the drug companies who generated and have profited from this plague. If you or someone in your family has an opiate problem, we will provide you the resources you need to help you recover. We owe you that." Quote, Andrew Yang. Andrew Yang promotes government spending on the crisis and punishment for the corporations who helped create the crisis, which we also agree with. We also agree with the stance of Elizabeth Warren, who we discussed earlier.
However, some of these policies dealing with opioid addiction promote safe injection sites. We feel that safe injection sites are not the answer to helping people. If every city had an injection site, we would see much higher rates of people abusing opioids, which contradicts the overall goal. A former director of National Drug Control Policy, David Murray, agrees with our stance.
It doesn't lead to harm reduction. These policies for safe injection facilities or administering heroin to heroin addicts fails both tests of any sound public policy. It's neither humane, no government addicts its own citizens or enables them in sustained addiction, nor is it effective public health strategy. It doesn't work. It doesn't protect people. They continue to inject. They go outside the facility, continue to overdose. Their tolerance for heroin grows. They put themselves even more at risk for both heroin death and also from death from diseases like HIV/AIDS. These policies are counterproductive and they're the wrong answer.
The first step in solving the crisis starts with doctors. It is their responsibility to cut down on prescribing opioids and to stop accepting bribes from large pharmaceutical corporations. If doctors stop prescribing opioids now and find alternative painkillers, then it is inevitable that the crisis ends eventually. In order to help those who are currently suffering, decriminalization is the first step, so victims of addiction can get the help they need without fearing punishment. Another solution is making rehab programs and other medically assisted treatment more affordable, so all addicts can have access to these programs.
The opioid crisis is a serious issue. Millions of people are dying, families are being destroyed because greedy pharmaceutical companies are profiting off people's addictions. This has caused a new wave of legislation with hopes of preventing the opioid crisis from worsening. Although some of these acts are improving the situation, more needs to be done. We must decriminalize opioids and make it a health issue rather than a political issue.
The government must pass legislation that helps those affected by addiction rather than punish them. We also must eliminate pharmaceutical corruption and pass laws that protect people. In Seattle, we can see this crisis unravel before our very eyes, and it must come to an end.
We have to treat this not as a moral failing, but as a public health problem that can be solved